Hi Venus, this is Dr. Srikanth from Team Inbde Conquer. Now I'm just here to give a glance about the subject oral path and oral medicine. Okay, so before you start this particular subject, that is oral path and oral medicine, of course you're well familiar with this oral path, which is your third year subject, whereas medicine is a final year subject, right? It's a fourth year subject. But if you just have a glance and just analyze your stuff related to the integrated national boards, which is available for you in the online, okay, so they regularly ignore, or not very specifically, they never mention this oral path. Okay, the reason is very simple, because the oral path will always get integrated with oral medicine. Okay, so in oral medicine they talk about the few features which are there in oral pathology. This is what, and a part of oral pathology will get integrated with other subjects like your general path, because general path, when you talk about national boards part 1 and part 2, is very important. But now it is being integrated to integrated national boards. There are high chances that they may ignore few concepts of the general path, and they may focus more on the clinical features that will be covered in your general medicine and in your oral medicine. So oral medicine indirectly is going to be a combination of your oral path and oral medicine, a part of general path, a part of oral microbiology. A few such things will be covered integratedly here. For example, if you take the bacterial viral infections, or if you list out the fungal infections, or if you list out the spread of the oral infections, all these, they move around with a part of microbiology here. That is, you can consider it as oral microbiology, because general microbiology is very different when you talk about oral microbiology. Okay, so such things will be a combination of both. And in many futures, like when you're talking about this cysts of odontogenic origin, okay, or you talk about the salivary glands, or you talk about the diseases of bones and joints, okay, or you talk about physical and chemical injuries, most of these are interconnected with the radiology, a part of radiology. Okay, so make sure radiology is, again, you can consider radiology as a two parts. Okay, one is part 1 and part 2. Part 1 will be focusing more on the general aspect, means what is radiation therapy, how the X-ray is being formed, how you're going to fix it, what is your developer, what is your fixer, and all those things, how you take extraoral radiography, how you take intraoral radiography, or paralleling angle technique, bisetting angle technique, different techniques of extraoral, all this comes under the general part. General part will be discussing along with radiology in the schedule. But now we'll be talking about the diagnosis related stuff of radiology. So radiology related to the diagnosis means every disease has one or less radiographic features, which we'll be discussing along with the pathologies in the oral medicine. I hope you're very clear, right? So a part of oral radiology will also be integrated here. So this is how we have prepared these integrated videos, which covers the cases, which covers the radiographic features, which covers the diagram based questions and everything. Because nowadays, if you see integrated national boards, most of them are concerned with the patient box. Okay, in the last online session, for the pro-batch students of integrated national boards, we have discussed what is this patient box, how they are asking questions, because patient box questions are very conceptual things. If you're strong in the concept, it is easy for you to handle the question and go with the right answer, right? So we have discussed how the patient box questions and everything will be there. So keeping all those in mind, this chart was prepared. Okay, and I want you guys to go ahead with the schedule. So I have given a beautiful schedule covering this subject, because this subject is one of the core subject in the list of integrated national boards, which you cannot skip. You cannot go to the examination. Like if you talk with your seniors who are done with the national boards, if I talk with my alumni students, because national boards is just like a pass or fail exam. Okay, means when you're planning to go for exam in a critical situation, you can ignore few subjects. Even if you ignore one or two minor subjects, even then you crack the exam. You come back and crack the exam. Students simply telling that, sir, we are not done with 2 or 3 subjects, or I'm not 100% sure of my preparation, but for the God's grace, I have done with my exam. I got the results, sir, this is the pass. So most of them, this is a very common thing that we regularly hear. But make a note, if you are doing that, this subject cannot be ignored. You cannot leave this subject and go to the examination, because this subject is going to be high scoring subject, and of course interesting and easy, right? So what my consent is, you can just follow the schedule which was given to you, and we have videos. Okay, you have smart videos covering all these subjects, and of course I want you guys to finish. Along with the smart videos, I want you guys to finish the dental dex parts of this oral medicine. Hardly you have the topics what I have segregated, hardly you have 12 to 15 cards each. Maximum is 12 to 15. Sometimes you find like 2 to 3 cards related to each subject, but make sure you try to integrate that cards to that of the video discussions what are available on your website, right? So that is first foremost important thing that you have to make a note. And if you open your mass-based part 2 book, okay, so you don't have a specific subject called as oral medicine, but you have something called as oral diagnosis. So your mass-based part 2 oral diagnosis has to be again integrated. Okay, it's something like it's going to be like a shortcut. Okay, for example, if they're talking about ameloblastoma, they focus on key important things, clinical features. They move to the radiographic features, talk about few radiographic features, then move to the treatment plan. This is going to be 5 or 10 lines maximum. Then they shift to the next one. If they're talking about cyst, radicular cyst, how it occurs, clinical features, and followed by the treatment plan. Simple, like we regularly follow the same pattern. Okay, for example, if you're talking about a disease, make sure the other names of the disease, means the synonyms of the disease, followed by etiology of the disease, followed by any classification related to the disease, severity classification. Sometimes you have a severity classification. So before, if it is up to this size, this is small, this is large, this is like you have the severity based classification, or sometimes a disease may have a normal classification. It is divided into classical type or idiopathic type. Some classifications will do that. Then after, I want you guys to move to the clinical features. Very specifically, you should focus on oral clinical features, because most of your patient box questions, I was talking about something called as patient box questions. Most of your patient box questions will move around the clinical features, followed by add a note about the radiographical features or any microbiological features or biochemistry related investigations, and followed by the treatment plan. This is a regular thing. This is what the pattern that is being followed in this specific book, which you should not miss. That is most-based part 2. Okay, so these are the 2 mandatory things I want you guys to do in the round 1 and integrate them with the smart videos. That is more than sufficient. So every topic which was listed in the previous slide, we try to provide as many MCQs as possible, and specifically I'll try to add RQs. That are the recent questions which are taken from different sources. Okay, so they will be added. And of course, as I already mentioned, you have 2 live classes each of 2.5 hours. The dates of these live classes will be updated very soon onto the permanent groups of this integrated national board students. Okay, so we'll update you about the live classes. Mostly will try to solve the patient box questions. Okay, and you'll get more often like questions related to the recent things, like things which are being asked in the exam. Okay, recently in the recent sessions, all those things will be covered in the RQs. And during this session of that is the oral medicine and oral pathology, we are going to have a session by Dr. Sirisha. She's going to explain you all the stuff related to the processing of your the first step of processing of your integrated national boards. What are the steps that you have to take, what are the things that you have to follow, and a few suggestions about improving your profile will be started by Dr. Sirisha during this particular subject. Okay, so I'm done for now. Signing off, Dr. Srikanth from team INBD Conquer.